Quiet, lethal, unseen. These terms perfectly describe obstructed arteries representing one of the most perilous health threats affecting millions, often without their knowledge. Even as you're watching this, your arteries could be gradually constricting, hindering vital blood flow to your heart, brain, and limbs. In America, someone succumbs to cardiovascular disease every 36 seconds. Yet here's the startling truth. The majority of these fatalities could have been averted if warning signals were identified sooner. The tragedy is that your body constantly sends out alarms about blocked arteries, but these are frequently disguised as routine irritations that we tend to brush off or disregard. That unusual weariness you've been feeling, the slight breathlessness when ascending stairs, the cramping in your legs during walks, these aren't merely indications of aging. They might be your body's urgent pleas, warning you of a serious issue within your circulatory system. Before we delve into these crucial warning signs, if you're new here, welcome to your path toward improved cardiovascular health. Hit that subscribe button and activate the notification bell so you don't miss our life-saving content. Your heart will undoubtedly appreciate it. And please, let us know in the comments which country you're tuning in from. We truly enjoy connecting with our worldwide community of health-conscious viewers. Today, we're unveiling 10 vital warning signs that could indicate dangerously blocked arteries. These aren't just minor inconveniences. They are potentially fatal symptoms, supported by research from prominent medical institutions such as the Mayo Clinic, Cleveland Clinic, and UT Southwestern Medical Center. What you're about to discover could genuinely be the difference between early problem detection and confronting a medical emergency that could end your life. Now let's explore the warning signs of blocked arteries, starting with the very first: chest discomfort or angina. The initial warning sign is chest discomfort, medically termed angina. However, here's the perilous aspect. This sensation doesn't always present as the dramatic chest-clutching pain often depicted in films. Many individuals describe it as a feeling of pressure, tightness, squeezing, or aching within the chest. According to research from the Mayo Clinic, this discomfort is, quite literally, your heart muscles signaling a lack of oxygen when coronary arteries become narrowed by plaque accumulation. The underlying mechanism is both captivating and alarming. Your heart muscle demands a continuous supply of oxygen-rich blood to function correctly. When plaque builds up in your coronary arteries, it creates a constriction that limits blood flow. During periods of increased demand, such as climbing stairs or experiencing emotional stress, your heart requires more oxygen, but the constricted arteries are unable to deliver it adequately. The pain isn't solely confined to your chest either. It can radiate outwards, much like malfunctioning electrical signals, traveling to your arm, particularly the left arm, neck, jaw, back, or upper abdomen. This pattern of spread occurs because your heart shares nerve pathways with these other bodily regions. Angina typically manifests during physical exertion when your heart needs more oxygen, then recedes with rest as the demand decreases. This predictable pattern often deceives people into believing it's merely fatigue or muscle strain, when in fact it's your heart's urgent cry for help. Each episode of angina signifies your heart struggling to receive sufficient blood flow. Research consistently demonstrates that angina is frequently the first indicator of significant coronary artery disease. Those who experience it face a considerably elevated risk of heart attack. Any recurring chest discomfort that aligns with an exertion pattern warrants immediate medical evaluation. Do not dismiss it as stress or indigestion. Your life could genuinely hinge on recognizing this crucial warning. Next, we move to number 2, shortness of breath. Unexplained shortness of breath isn't merely the expected breathlessness after intense exercise. It's feeling winded during activities that previously posed no challenge, or even experiencing breathlessness while at rest. This symptom is particularly insidious because its development is gradual, making it easy to rationalize away. When arteries become blocked, your heart struggles to effectively pump blood throughout your body, leading to a dramatic reduction in pumping efficiency. Imagine attempting to water a garden through a kinked hose. Regardless of how hard the pump works, insufficient water reaches its destination. This translates to your tissues not receiving optimal oxygen delivery, and your body compensates by making you breathe faster and harder, desperately trying to extract more oxygen from each breath. Mayo Clinic research indicates that dyspnea is often one of the earliest signs of heart failure, which frequently stems from long-term arterial blockages that have progressively damaged the heart muscle. As your heart weakens from continuously laboring against blocked arteries, its efficiency in pumping blood diminishes, resulting in fluid accumulation in your lungs. Women, in particular, should pay close attention to this symptom, as research reveals they are more prone than men to experience shortness of breath as their primary heart disease symptom, rather than the classic chest pain typically observed in men. The progression is deeply concerning, starting with breathlessness during activities like climbing stairs, advancing to feeling winded during flat walking, and eventually occurring during routine activities such as getting dressed or having a conversation. This progression signifies your heart's declining capacity to meet your body's oxygen demands and serves as a countdown to more severe cardiovascular events. Next, number 3, dizziness, lightheadedness, or sudden nausea. This combination of symptoms, dizziness, lightheadedness, or sudden nausea, points to diminished blood flow to your brain due to arterial blockages. When the arteries supplying your brain or heart become narrowed, your body struggles to maintain adequate oxygen delivery to vital organs. Dizziness occurs when your brain doesn't receive enough oxygen-rich blood, leading to that disorienting, spinning sensation. Research from UT Southwestern Medical Center indicates these symptoms frequently co-occur during cardiac events because they share a common underlying mechanism: reduced cardiac output stemming from blocked coronary arteries. When your heart cannot pump effectively, it struggles to maintain sufficient blood pressure. The sudden nausea is especially significant. Your digestive system requires a substantial blood supply, and when your heart's pumping ability is compromised, blood flow is redirected away from digestive organs to prioritize critical areas. Many individuals dismiss these symptoms as merely dehydration or stress. However, when experienced together, they could signal serious arterial blockages that demand immediate attention. If you suddenly experience dizziness, lightheadedness, and nausea concurrently, particularly if accompanied by chest discomfort or shortness of breath, this could be indicative of an acute cardiac event. Next, number 4, unexplained sweating, fatigue, or cold sweats. Cold sweats, in particular, are deeply concerning warning signs. Unlike normal perspiration caused by heat or physical exertion, cold sweats emerge when your body is under severe stress due to inadequate blood flow to vital organs. When arteries are blocked and your heart struggles to pump effectively, your body activates emergency response systems, triggering stress hormones that result in sudden, clammy sweating. Cardiovascular research consistently shows that unexplained fatigue is often one of the earliest indicators of heart disease, especially in women. This is not ordinary tiredness. It is a persistent, overwhelming exhaustion that fails to improve with rest. When arteries are obstructed, your heart must work considerably harder to pump blood, eventually leading to heart muscle fatigue that manifests as full-body exhaustion. As blocked arteries restrict blood flow to your heart muscle, your heart's efficiency diminishes. Your heart compensates by beating faster and working harder, but this increased workload fatigues your heart muscle. This cardiac fatigue then translates into systemic fatigue, impacting your entire body. Women are more likely to experience fatigue and sweating as primary symptoms of heart disease, rather than the more typical chest pain. Many women report sudden, inexplicable exhaustion for days or even weeks prior to a heart attack. Next, number 5, pain that spreads beyond the chest. Pain that extends beyond your chest can create a complex web of discomfort, potentially confusing both patients and healthcare providers. When your heart muscle doesn't receive adequate blood flow due to blocked coronary arteries, the pain doesn't adhere to specific boundaries. The heart shares nerve pathways with various upper body regions, causing cardiac pain to manifest in the shoulders, arms, back, neck, jaw, teeth, or upper abdomen. Mayo Clinic research thoroughly documents this pain pattern. Left arm pain is strongly associated with cardiac events, though pain can affect either or both arms, often described as an ache, heaviness, or pressure rather than a sharp sensation. Back pain between the shoulder blades is frequently reported but often dismissed as muscle strain. Jaw and neck pain present diagnostic challenges because they are commonly attributed to dental issues or neck strain. However, when jaw pain occurs alongside other cardiovascular symptoms, or appears during exertion and subsides with rest, it strongly suggests a cardiac origin. The pain might feel like a toothache, but its pattern reveals its true cardiac nature. Upper abdominal pain is perhaps the most misleading, often mistaken for indigestion when it should prompt emergency medical care. The danger lies in individuals seeking incorrect treatments, visiting dentists for jaw pain, or trying antacids for abdominal discomfort, while underlying arterial blockages continue to threaten their cardiovascular system. Next, number 6, leg pain or cramping while walking. Leg pain or cramping that occurs during walking and diminishes with rest is indicative of peripheral artery disease, PAD, a condition where arteries supplying your legs become blocked. This symptom typically manifests as cramping, aching, or fatigue in the leg muscles during activity, most commonly affecting the calves but potentially also the thighs, hips, or buttocks. Research in vascular medicine demonstrates that peripheral artery disease rarely occurs in isolation. Experts at Cleveland Clinic note that PAD affects over 200 million people globally and approximately 12 million adults aged 40 or older in the US. If you have blocked arteries in your legs, there is a high probability of arterial blockages in other critical areas, including your heart and brain. This makes intermittent claudication a systemic warning sign that your entire arterial system is compromised. The mechanism is concerning. When leg arteries become narrowed by plaque, they provide adequate blood flow at rest, but are unable to meet the increased demand during activity. This leads to muscle cramping as tissues experience oxygen deprivation. The pain is predictable, appearing after consistent walking distances and reliably improving with rest. Many individuals dismiss leg cramping as a normal part of aging, poor fitness, or muscle strain. However, true intermittent claudication possesses distinct characteristics that differentiate it from other causes of leg pain. The progression is particularly alarming, initially noticed during longer walks, then occurring with shorter distances, eventually limiting normal daily activities as arterial blockages worsen. Next, number 7, non-healing foot or leg sores, coldness, or color changes. Visible alterations in your feet and legs, such as non-healing sores, persistent coldness, and changes in skin color, signify severely compromised blood flow. These symptoms represent advanced stages of peripheral artery disease, indicating that arterial blockages have reached perilous levels. When arteries supplying your extremities become severely obstructed, tissues do not receive adequate blood flow to sustain normal healing processes and temperature regulation. Non-healing ulcers or sores persist for weeks or months because blocked arteries cannot deliver sufficient oxygen and nutrients for repair. Cleveland Clinic research documents that persistent coldness in the feet or legs, particularly when one limb is noticeably colder, points to significant arterial blockages. Your extremities should maintain a consistent temperature through adequate blood flow. When compromised, feet and legs feel persistently cold, even in warm environments. Color changes provide visible evidence of impaired circulation. The skin may appear pale, bluish, or shiny due to reduced blood flow, sometimes with mottled patches indicating uneven blood distribution. Hair loss on the legs and feet is another indicator of circulation issues. Hair follicles require adequate blood flow for normal growth, and reduced circulation causes hair growth to slow or cease entirely. The temperature difference between limbs can be particularly telling. If one leg or foot feels distinctly colder than the other, this suggests a significant arterial blockage affecting that specific limb, indicating substantially compromised blood flow compared to the other side. Next, number 8, erectile dysfunction in men. Erectile dysfunction, ED, often functions as an early warning system for arterial blockages throughout the body, frequently surfacing years before more overt cardiovascular symptoms appear. Erectile function is entirely reliant on adequate blood flow to specialized penile blood vessels. Research from the Physicians Committee for Responsible Medicine establishes a strong correlation between erectile dysfunction and cardiovascular disease. The arteries supplying the penis are smaller than those serving the heart and brain, meaning they often become obstructed by plaque before larger arteries show significant narrowing. Men who develop erectile dysfunction, especially without apparent psychological causes, have considerably higher rates of heart attack, stroke, and peripheral artery disease in subsequent years. Atherosclerosis does not discriminate by location. If plaque accumulates in penile arteries, It is likely accumulating throughout the body, including the arteries of the heart and brain. What makes this connection invaluable for early detection is its timing. Erectile dysfunction often appears years before other cardiovascular symptoms become noticeable, offering men a potential window to address underlying arterial disease before it progresses to dangerous stages. Many men attribute erectile dysfunction to stress, aging, or psychological factors. While these can play a role, the vascular component should not be overlooked. When occurring without clear psychological triggers, particularly in men over 40, it warrants a cardiovascular evaluation. This symptom illustrates how interconnected your circulatory system truly is. Problems in one area often reflect issues throughout your entire arterial network. Next, number 9, transient ischemic attack or stroke-like symptoms. Transient ischemic attacks, TIAs, or stroke-like symptoms signal that brain arteries are blocked or severely narrowed, causing temporary interruptions in blood flow that produce neurological symptoms. A TIA begins like a stroke, producing stroke-like symptoms such as numbness or weakness, but it resolves within a few minutes or up to 24 hours without leaving any lasting effects. The symptoms are unmistakable: sudden numbness or weakness affecting one side of your face, arm, or leg, facial drooping creating an asymmetrical appearance, speech, difficulties with slurred or garbled words despite clear thinking, difficulty understanding others' speech, and vision problems, including sudden vision loss, double vision, or visual field cuts. Research from UT Southwestern Medical Center emphasizes that these symptoms, even if they completely resolve within hours, represent medical emergencies. Approximately 1/3 of individuals who experience a TIA will later suffer a more severe stroke. The temporary nature often deceives people into believing the episodes weren't serious, but TIAs indicate that brain arteries are severely compromised and a major stroke could occur at any time. The carotid arteries, which supply blood to the brain, are common locations for blockages that cause these symptoms. These large neck arteries can develop significant plaque buildup that either directly blocks blood flow or releases small clots that travel to smaller brain arteries. Speech difficulties occur because brain areas responsible for language processing are not receiving adequate blood flow. Vision problems can be particularly frightening. Portions of the visual field simply disappear, as if a curtain has been drawn across part of your vision. These symptoms demand immediate medical attention, regardless of whether they resolve. Next, number 10, the 6 Ps of acute limb ischemia. The most severe warning sign of arterial blockage is acute limb ischemia, commonly remembered by the 6 Ps: pain, pallor, pulselessness, paresthesias, paralysis, and poikilothermia. This critical condition arises when an artery supplying an arm or leg becomes suddenly and completely blocked, representing a true medical emergency. The pain is severe and sudden, constant, and does not improve with rest, often described as a deep burning sensation within the affected limb, progressively worsening as tissues become oxygen deprived. Pallor refers to a pale appearance. The limb loses its normal coloration and appears pale, white, or waxy compared to the unaffected limb. Pulselessness means that normal pulses cannot be detected below the level of the blockage. Healthcare providers check for pulses at various arterial points, and in acute limb ischemia, these pulses are absent. Paresthesias involve abnormal sensations such as tingling or numbness as nerve tissues become oxygen deprived and begin to malfunction. Paralysis represents a loss of motor function as muscles and nerves become increasingly oxygen deprived, often beginning with weakness and progressing to a complete inability to move fingers, toes, or the entire limb. Poikilothermia refers to the limb becoming cool to the touch due to inadequate blood flow to maintain normal temperature. These symptoms signify a race against time. Tissues can survive only limited periods without blood flow before irreversible damage occurs, potentially necessitating amputation. The presence of multiple P symptoms indicates a surgical emergency where hours or even minutes can determine whether a limb can be saved. These 10 warning signs represent your body's sophisticated alarm system, desperately attempting to alert you to arterial blockages that could threaten your life. From the subtle pressure of angina to the medical emergency of acute limb ischemia, each symptom provides crucial information about the state of your cardiovascular system. The tragedy is that most people disregard these warning signs until it's too late. Recognition and prompt action are absolutely vital for survival. These symptoms do not occur in isolation. They often represent a spectrum of arterial disease affecting multiple parts of your body simultaneously. If you recognize any of these warning signs, especially multiple signs appearing together, you must seek immediate medical evaluation. When it comes to arterial disease, time is literally life. Remember that arterial blockages develop gradually over many years, much like rust slowly accumulating in pipes. However, their consequences can manifest suddenly and dramatically. The chest discomfort you might dismiss as stress, the leg cramping you attribute to getting older, or the breathlessness you blame on being out of shape could all be early warning signs of life-threatening arterial disease. These symptoms are your body's way of urgently imploring you to pay attention before it's too late. Your cardiovascular system is intricately interconnected. Blockages in one area often indicate problems throughout your entire arterial network. This means that peripheral artery disease in your legs could signal hidden coronary artery disease threatening your heart, or erectile dysfunction could be a warning of impending stroke risk. Individuals who recognize these symptoms early and seek appropriate medical care experience significantly better outcomes than those who ignore the warning signs until major cardiovascular events occur. The research is unequivocally clear. Early detection and intervention can prevent heart attacks, strokes, and other potentially fatal cardiovascular emergencies. Your life may literally depend on your ability to recognize these symptoms and take them seriously. Do not become another tragic statistic. Act on these warning signs. If you found this video helpful, please type "helpful" in the comments. That genuinely motivates us to create more content like this. Please like this video if it provided valuable information. Share it with friends and family who need to be aware of these critical warning signs, and subscribe to our channel for more life-saving health information. Thank you for watching, and thank you for taking your health seriously enough to learn these potentially life-saving warning signs.